DSM-5 that was created in 2013. Functional Neurological Disorder was formed, the term was formed as a way of better describing what is happening, because there has been a tremendous amount of research going on over the past 10 to 15 years. So now we understand much better what functional neurological disorder is. So we have supportive scientific evidence that is a dysfunction between mind, body, emotions, and environment. And I'm going to show you some of those imaging studies during upcoming sessions. The diagnosis is now mainly made by the neurologist, and it's very important to do a neurological examination to gather a comprehensive history and to do appropriate testing to see if it's a disease of the structure and the organ or if it's a problem in the function. So it moved from being a disease that psychiatrists and psychologists diagnose and treated to be a disease diagnosed now by neurologists. And the neurologists play a very important role in treatment. And we're going to talk about treatment later on. So we still are having a hard time understanding the causes, the etiology. And we will talk a little bit about the limitations of the healthcare system and why we're not understanding it yet. And it comes down to, we're so divided in subspecialties that we're really missing the forest. We are organisms, complex organisms embedded in our environment. And unless we do a holistic approach and look at everything that influences us from all the different angles, then of course we will miss the cause. We'll talk more about that in subsequent sessions. So the term functional neurological disorder accepts the vital and inseparable relationship between the mind and the body. It's all one. And I would say mind, body, emotions, and spirit, but that's part of my own research. And again, the term supports that the physical symptoms are not associated with the problem in the anatomy or the structure of the nervous system, but it's a problem of the functioning. And it's hard to determine the causes. More so, the causes are usually not very apparent during the first sessions with the doctor. There has to be a lot of investigation of the physician and the patient together to find the cause. And the cause is so unique for each one of us, each one of you. Like for me, it was the medical career work and my work at the time. I was working as a bartender, right? Like it's so unique. For me, it was overwork, but the cause is so different for each one of us. And then it's very important to study the psychological well-being. So study the physical body, the psychological well-being. And I would say also to study the environment, as I always say, the four